My name is Tim. I work at Rawls MD with Dr. Rawls, and I'm really pleased to have him here with us to do a little interview and give you guys a preview of what's going to be in the book. Thanks so much for all of your questions that you emailed into us. We're definitely going to get to those towards the end of the webinar today. I'll start out with interviewing Dr. Rawls about the book, and then we'll get to your questions. As we do with all of our webinars, we want to give you something special for being here today and registering for the event. So right after the initial interview, we've got some details to share about that for buying the book today. And I know many of you have met Dr. Rawls before or heard him speak. But for those of you that haven't, just wanted to do a quick introduction. Dr. Rawls got his medical degree from the Bowman Gray Medical School in Wake Forest back in 1985. He holds his medical license in North Carolina and has written a lot about chronic illnesses like Lyme disease, fibromyalgia, and chronic immune dysfunction, all from personal experience. And so we're really glad to have you here today, Dr. Rawls, to talk to us more about your new book, Unlocking Lyme. Welcome.
Thank you, Tim.
Great. So, yeah, good. Glad everyone's excited to have you here as well. And I know you've worked really hard on this book for the past 6 months to a year, really, in creating this. So
yeah, it's been
we're
a
excited
project for sure.
Awesome. Well, we definitely want to dig into it here, and just let's dive right in, Dr. Rawls. In the introduction of your book, you talk about your life in conventional medicine. Say 10, 15 years ago, and really feel like you were swimming against the current. What did you mean by that?
Well, during my practice, I was fine, but once, after 15 years of taking obstetric call, my body started breaking down. I probably had the microbes that cause Lyme disease in my system, and at first thought I had my fibromyalgia, but the situation just got worse to the point that I couldn't take call. That forced me out of the practice, and I started a primary care practice, but I started it with the idea of creating a practice based on wellness and discovered that our system really isn't designed to help people with wellness. So that at that point, I felt like I was somewhat swimming upstream in that I wasn't turning over patients and writing prescriptions. I was recommending herbal therapy and non-traditional things. I was helping people get their lives back and get their health back. And it just didn't fit into the medical system very well.
I think a lot of people can experience that. I wonder if we have other doctors that are on the webinar that feel in the same position as you. I know certainly many patients out there have been frustrated by it and figuring out the best way to use it for some of these conditions. A lot of folks have read Suffered Long Enough, your previous book. What would you say is the difference between these two books? What brought you to writing Unlocking Lyme?
Suffered Long Enough was a heartfelt attempt to describe my situation and what I was going through and the things that I had utilized to help myself get well, and I had found work for other people also. But it was a point in time that I was still managing a full-time practice and trying to develop supplements and had a lot of things going on in life. So that book was written nights and weekends whenever I could really get a chance to do it. For Unlocking Lyme, I really wanted to make a full effort to explore Lyme disease and look for solutions and help people with a comprehensive resource. So I actually took a full year. I took a sabbatical off of work just to write that book. So for 9 months, it was 6 to 8 hours a day of writing and researching. And this book is much more comprehensive. It's less about my story. It's more about getting well from Lyme disease and understanding what Lyme disease is. And it's also much more well researched. For virtually everything I said in the book, I found scientific studies that backed it up. So there are probably about 30 pages of single-space citations that document the things that I said in the book. And that's very important to make it a credible work.
That's awesome. I know everyone appreciated hearing your personal story and suffered long enough, but I'm sure they'll enjoy getting into more of the nitty gritty on all the different things that you cover on specifically on Lyme and chronic immune dysfunction. Um, there are a lot of other Lyme books out there. So what would you say kind of makes Unlocking Lyme stand apart from say some of the other most well-known books? I know, for example, Dr. Stephen Booner's work has made a big impact on you. How is this different than that or some of the other resources out there that people are familiar with?
Well, I would say Stephen Bruner's book is something by itself altogether. It is different than most books on Lyme disease. Most books out there are either personal experience that people have had with Lyme disease or experts writing about Lyme disease. But most of them are from the point of view of this infection with a microbe and how I overcome this infection to get well. And what I've discovered through my personal experiences and working with others and my exploration of what Lyme disease is that it's a complex illness involving multiple microbes, not just one microbe, and it's rooted in immune dysfunction. When the immune system becomes chronically disrupted, these microbes are able to take hold in the system and start doing damage. In my case, I think I probably harbored Borrelia and other microbes for a long time, and it was doing every other night call and the stress of trying to run an obstetrics practice that allowed those microbes to start flourishing in my system and cause problems. And I think that's a story for a lot of people. An awful lot of people with chronic Lyme disease can't remember when they got the tick bite, and many people don't know exactly what they have as far as the microbes that are involved in their situation. They just know they're miserable and they would like to be well, and not very many people have been able to help them.
So this probably brings us to the title. I think for a lot of people it can be quite a mystery. Is that what you were going for with the title choice of Unlocking Lyme?
The title just seemed to fit. There's so many misconceptions about Lyme disease, and when you read one book or one person's opinion, it's completely different than another person's opinion. So in my exploration, I explored other people's opinions. I explored the data as far as what we know about these microbes, what we know about these kinds of illnesses, and brought it together into a concept that fit, that really demonstrated what Lyme disease is, and it's different than the mainstream view. I don't think about Lyme disease the same way that many doctors who treat Lyme disease do. And I think that gives me a foundation to look better toward ways that you can overcome this disorder.
Great. So we've got the book here for everyone, and you can see it's a pretty comprehensive book, but don't want it to scare you off because I think you've done a really good job, Dr. Rawls, of breaking down these complicated topics into more digestible pieces. Would you give the viewers out there an idea of just what the general gist of the book, how it's organized, the flow of the contents for us?
Sure. I broke the book up into 4 sections, and I thought that was important to carry the person through a whole process. So the first section is really understanding what Lyme disease is. So I carried the person from this idea of this infection with a microbe causing a illness to a more appropriate concept of a spectrum of a complex disorder or disease involving multiple microbes rooted in chronic immune dysfunction, and looking at what are those underlying causes that disrupt the immune system in such a way that these microbes can flourish and cause illness. That's important. Getting that foundation, understanding what the disease is essential before you look at how do you overcome it. Part 2 is looking at the current state of microbial testing, which is somewhat limiting and somewhat misleading. There are quite a few more microbes out there that can potentially contribute, to this condition than we know about. There are at least 20 different forms of Borrelia that are associated with illness, 12 of them associated with Lyme disease, and we're only testing for a handful. Besides that, there are probably many others that haven't been discovered yet. It seems like about every year they discover 1 or 2 new species of Borrelia. And then you've got Bartonella and Mycoplasma and Chlamydia and Epstein-Barr virus and all of these other microbes that do play a role. So it's important to understand what testing is available, the limitations of that testing, and how we can better utilize what's available to understand this condition to move forward. I also take the time to help people to understand the medical system. Our medical system is really good for treating acute illness, but we're not very good at treating any chronic illnesses. And so there's a whole chapter devoted to helping the person understand their own resources, how to use their local doctor, how to get most benefit from the healthcare system, what kind of other resources available, and when you might want to use those resources. So it very comprehensively goes through the present state of testing that doctors are using and gives recommendations of which tests are the most valuable. In part 3 of the book, I explore overcoming Lyme disease therapy. And I separate therapy, the process of treating disease, into 3 different categories. Restorative therapy, symptomatic therapy, and heroic therapy. And this is very useful for defining a holistic approach to getting well. Restorative therapy is that foundation, that fundamental basis that you need for building a foundation of wellness, for restoring the immune system back to normal, to enhance the healing systems of the body, and suppress the microbes at the same time. The cornerstone of restorative therapy is herbal therapy. Herbs do a lot that other kinds of therapies really don't do, but they do it in such a way that the potential for harm is near zero. So it's extremely low. You can use these herbal therapy in high doses for long periods of time without any concern that it's going to harm the individual. What herbs are doing is suppressing the microbes, reducing the inflammation that the microbes are actually generating to break down tissues to get at resources. And it also reduces inflammation. It helps the immune system work better, basically get back online so it can take care of these microbes that are the problem. And it does other things like providing antioxidant support and a wide range of other support in balancing hormone systems in the body and basically getting the body back online to take care of itself. But that takes time. You don't treat symptoms specifically. Symptoms gradually get better over time as this process is going on. So sometimes symptoms can get in the way, especially if the person is not sleeping or they're having significant pain. So that's where symptomatic therapies come in. Things that treat symptoms particularly, but don't really promote wellness that much. Often that's drugs, but there are some natural things and alternative things that do offer benefit. The limitation of symptomatic therapies is that it's not really contributing to the wellness process. So in the beginning, symptomatic therapy, just relieving symptoms, can be very valuable. But as therapy progresses, then you won't tend to need them as much. Heroic therapies are the things that acutely affect a disease process very directly and very potently. Antibiotics would be a heroic therapy. Ozone, that I'm sure you've heard of, is a heroic therapy. So there are quite a number of different heroic therapies out there. And that's the mainstay. That's usually what we start with first. But the problem with heroic therapies is they have a price. There's toxicity with any kind of heroic therapy, antibiotics especially. I always tell people that whenever you use a heroic therapy, you begin a race. Are you going to achieve the goals that you want with that therapy before the toxicity of the therapy starts catching up with you and you actually start reversing and going backwards? So I tend to hold heroic therapies for that last effort. If nothing else is working, or acutely to bring the body back in line, heroic therapies have value, but you generally aren't going to use them long term. An analogy I like to use is a leaky dam. If you've got a dam that the structure is getting ready to collapse and the dam is getting ready to break down and there are leaks and cracks in the dam, heroic therapies are good for plugging up those leaks and cracks temporarily until you can put the structure back together like it should be. But if all you're doing is plugging the leaks and the cracks, sooner or later that entire structure is going to break free. So I see it as restorative therapy as your base, your foundation. That's what's most important. Symptomatic as you need it to treat symptoms, and then heroic therapy when nothing else works or when you need something very acutely. So the pyramid that you see works very nicely for that. And if we were doing that across the board, I think we would be getting better results for not only Lyme disease, but many other conditions.
Dr. Rawls, where would you say most folks that come to you, where are they on this spectrum? Are they most people trying symptomatic or the heroic or restorative therapies?
So in our conventional therapy, in conventional medicine, we almost use heroic and symptomatic exclusively. We treat people's symptoms and we slam them with some heroic thing. And if you break your leg or come in with an acute pneumonia or something, or a heart attack or a stroke, that's the best thing you can do. But if you're looking at overcoming any kind of chronic illness, if you're not building that restorative base, then you're in trouble. Also, a part of that restorative base, and I forgot to mention, part 4 of the book, is just going that step further to establish wellness, to hold on to wellness once it's there. And that's addressing diet, detoxification, generating endorphins with exercise, and doing the things that you need to do to enhance wellness within your body. So part 4 of the book is devoted to that exclusively. So we cover all the bases. That's what a holistic approach is all about.
Would you say this book is for Lyme patients only, or is it accessible and useful to a broader audience?
Absolutely. Much broader than just Lyme disease alone. You have to pick a topic, but when you look at Lyme disease, it's like in the beginning, I just knew I was miserable. I had all these non-specific symptoms. I say non-specific, what I mean is that the symptoms don't point to any specific known diagnosis, and that's very common with a lot of diseases. Most of your chronic illnesses, autoimmune disease, Parkinson's, MS, you have non-specific symptoms in the beginning, things that don't really help point to a diagnosis. Brain fog, fatigue, general muscle aches, just feeling flu-like. They're common to so many diagnoses that it doesn't really help you define where you are in the spectrum of diagnosis. So when you look at chronic Lyme disease and you start seeing it as a disruption of immune function with chronic immune dysfunction and these microbes, not just Borrelia, but other microbes that are present that we're all exposed to. Everyone has some of these microbes in the margins of their body. And when you look at that as a foundation of what the illness is, lots of people with fibromyalgia have that same situation. Chronic fatigue has that same situation. And personally, I see all of these things on a continuum, that people start with early symptoms, they end up defining either, well, I've got chronic fatigue or fibromyalgia or chronic Lyme disease. But down the line, they're probably going to end up with ALS or multiple sclerosis or some autoimmune disease. And it's just a progression of the disease process. So what type of disease someone would end up with is very dependent on their genetic makeup, what factors came together in their lives to disrupt the immune function, and which microbes they have on board. We all have a little bit different spectrum of microbes. So when you look at chronic fatigue or fibromyalgia or chronic Lyme or any condition like this, it's a little bit different for every individual. And you have to respect that when you're looking at the process of helping someone overcome that condition.
I love that notion of a spectrum of disease, and just the idea that folks that have Lyme are a certain degree down the path. And so really, if it's restorative therapies we're talking about, then everywhere before that, it's still going to be useful at helping them so that they hopefully don't get to that point, or if they are there, hope kind of push it a little bit earlier in the spectrum. That's huge. And since you were saying most people are in the symptomatic and acute and heroic therapies part of the pyramid, one common question I know we hear a lot about is people wondering about antibiotics, specifically when and under what circumstances it can be useful to use antibiotics. So could you talk to everyone a little bit more about that?
Yeah, that's a topic that I go into very deeply in the book, and there are certainly a lot of opinions out there. There are many physicians across the country that are using high-dose antibiotics for extended periods of time. Other doctors are suggesting that there are absolutely no studies to back that up, and that's a waste of time, and it's not helpful. The evidence is looking more toward long-term antibiotic therapy is not that useful for treating Lyme disease, though there are some people that do benefit. The problems with antibiotics are that when you use a potent single agent ingredient to kill a microbe, it is not just affecting that microbe. You have trillions of microbes in your body. We have thousands of species. So when you target one microbe with antibiotic therapy, you're really targeting the entire microbiome, and that becomes a real problem. So why is it that antibiotics work at all? Well, the reason is most pathogens, if you got an acute pneumonia, that microbe is a very aggressive microbe. It grows very fast. In other words, it turns over generations very, very quickly. It's in high concentrations in the body. It's consolidated into one area. And for those kinds of things, conventional antibiotics work exceedingly well. If someone presented to my office with an acute pneumonia, I'd put them directly in the hospital and put them on antibiotics. I absolutely would not put them on herbal therapy. It would be negligence, because the herbs take a long time to work. They're more suppressive. So that fast-growing, high-concentration microbe, aggressive microbe, I need something very potent to take care of it. I need a heroic therapy. But when you look at Borrelia and Mycoplasma and Bartonella and the other microbes that are associated with Lyme disease, they don't act that same way. They occur in very low concentrations in the body. They're not consolidated or diffused throughout the body. In fact, most of these microbes are going where they can get away from antibiotics and the immune system. They're in joint spaces and deep in between cells, and they live inside cells, which prevents them from being affected by antibiotics. So they have very sophisticated mechanisms. They grow very slowly. A pneumococcal bacteria that causes pneumonia will go through a generation in about 20 minutes. Borrelia takes about 12 hours to do the same thing. So antibiotics aren't going to get it, and that's why they're typically using antibiotics for months and months and months on end to try to wipe out every bit of this microbe. But the problem is you start killing off the normal flora in your body, and you start isolating out pathogens in the gut. There's also evidence that synthetic antibiotics kill mitochondria, especially in the gut tissue. That's one reason a lot of people get fatigued when they're on antibiotic therapy. So there's a whole list of reasons why antibiotics aren't necessarily the first or best choice. Not to say that antibiotics don't have a place, and I address that very thoroughly in the book, but that place should be put in perspective with what kind of microbe that you're actually dealing with and how you should address that particular problem.
Great answer, very thorough. I hope that gives all the viewers a little taste of what else is in the book, because part 3 that covers those therapies is 12 chapters long. Antibiotics are definitely covered in there. So just wanted to do one of those to kind of give them an idea of the kind of resource that this is. I want to go on to Q&A to get some of our customers' questions soon, but maybe just one last question about writing the book, Dr. Rawls. I'm just curious, what were the hardest parts about writing this? What was your favorite part about writing Unlocking Lyme?
It's I was trying to fast forward the book. Most of the time a book will take a couple of years to write, and I wrote this one in less than a year, and it's a big book. And I was pushing pretty hard. I always started over the summer, started getting immune dysfunction myself, and was sitting there writing this book on immune dysfunction, and so I was starting to slip back into that myself, and was like, well, what's going on here? And I realized, I was spending 6 to 8 plus hours in front of the computer 7 days a week, and it's just really horrible for you. So I backed off. I balanced it with walking and spending some time off the computer. I went back to pad and paper, and everything got fine again. But probably the most frustrating thing was all the citations. Just backing up everything that I said, looking up studies, reading through studies, and then having to document all that with footnotes. That's the part of writing that just isn't very fun.
Well, I'm sure all the readers will appreciate that, and certainly know that it's tedious, but it's great to have all those reliable sources. What do you think was your favorite part of writing the book, Dr. Rawls?
Just writing in general. It's my passion. I love writing. It's like a puzzle. You start with just these ideas and thoughts, and then the thoughts coalesce, and then you pull the words together and play with the words, and it's just fascinating. It's so much fun. I really love writing.
Awesome. Well, we're looking forward to getting into the book more and getting it out into a lot of folks' hands. So we'll take a quick pause and let that wrap up my questions for you, and then we'll announce the promotion that I promised, and then we'll move on to some of the questions that you all emailed us. So I just want to pull up the slide that's got this information, and if you go to unlockinglyme.com, you'll see all this information is on there as well. So if you don't get it right now, just visit unlockinglyme.com. For the next few days, we are running a special on this to get this book out into as many possible. So the Kindle version is going to be just $2.99. It's usually $9.99. And the print version is going to be $10.49. It's usually $16.95. So either one of those, if you prefer a print one, like a lot of us, you can order that through unlockinglyme.com. And then as a special for folks who registered for this, we're also throwing in some extras. So some of those include Dr. Rawls' Unlocking Lyme email series. That's great. It's written by Dr. Rawls. It's going to guide you through, kind of looking at these concepts and how they might apply to you, and how to start steering your way towards getting a better foundation for health. And then we've also got an interactive health survey You can have a PDF or there's an interactive version. And this is taken from chapter 7 of the book. And then we've also got a free PDF download for those of you that go to unlockinglyme.com for Dr. Rawls' second book, Suffered Long Enough. So definitely go check that out, and we hope you'll buy the book and enjoy it and learn a lot from it. Let's jump back into the questions now with Dr. Rawls.
Awesome.
Bring back the video setting here. All right. So Dr. Rawls, one of the first questions is I know you're a proponent of the value of restorative therapies and specifically herbal therapies as a great example of that. Some of our customers wrote in wondering about the notion of a one-size-fits-all dose and how dosing an herbal therapy works, because a lot of supplements, it'll say, take 3 capsules of this, and they say, well, don't you have to apply that to the fact that I'm a male or female, my weight, etc. And a lot of folks are used to prescription drugs. So can you just kind of dive into that a little bit to kind of teach people about that concept?
Yeah, that's a common misconception. That's one that I had to really get used to over time too, being trained as a pharmaceutical-based physician. Herbs are completely different than pharmaceuticals, and pharmaceuticals are built for a specific purpose. Every pharmaceutical is designed to block or inhibit some pathway in the body to create a response. Sometimes blocking a negative occurrence in the body, sometimes blocking a symptom. And herbs really fundamentally work very differently than drugs do. When you look at herbs, basically we're using chemicals that are natural to the plant. So you have to ask, why are they there? Why are these chemicals in the plant? They're there to protect the plant, because plants have to deal with a wide spectrum of microbes just like we do, and they have other kinds of stress. They have physical stress and stress from sunlight and radiation and all of the same toxic stresses, and maybe even a little emotional stress. All the same stresses that we have, plants have to deal with too, except plants use a sophisticated biochemical solution to solve these problems. So when you take an herb, you're not taking a substance, a drug, a chemical. You're taking a wide spectrum of chemicals that are doing a lot of things. They're antioxidants. They're things that balance hormones. There is a wide spectrum of antimicrobials in every plant. So we're looking at something that's very, very comprehensive to start with. Now, the things that we define as medicinal herbs are the plants that people have been using, humans have been using since the dawning of time. So it's almost like our body recognizes these things. We accept herbal therapy, we accept specifically medicinal herbs, because these are the things that we've naturally chosen over time that mesh well with our biochemistry. So it's a natural fit. So when you're taking an herb, you're not doing the same thing that you're doing with a drug. And because the toxicity of herbs is so low, you can combine multiple herbs to get a really wide spectrum of benefits. Not just treating one microbe, but protozoa, viruses, bacteria, enhancing immune functions. And so modern herbology is learning what these chemicals are and how we can combine them to get these wonderful restorative powers. So it is true that everybody's an individual, every person's case is a little bit different, but everybody needs that restorative foundation. So when you're building that foundation, using a spectrum of herbs and enhancing other wellness aspects of the body through detoxification and dietary practices, then you get this robust healing benefit that is somewhat applicable to every single person. But part of the book is helping people individualize, looking at how can I individualize that restorative base to my needs what symptomatic therapy in the way of drugs or other kinds of things might be applicable to my situation, and when should I consider bringing that heroic therapy of different kinds in. And I discussed most all of the options out there pretty thoroughly.
I know in part 2 of the book, chapter 8, you talk about how best to use the medical system. That was another common question we got from folks that emailed us. What do you recommend for people that either can't afford the treatment plan that their doctor is recommending or may not have a Lyme literate doctor in their area?
Yeah, that's a really common question and a common frustration for a lot of people. I think that the Lyme doctors and the integrated physicians offer valuable services, but I think for most people, they're not absolutely necessary for people to have. And one thing that I wanted to do with this book as a resource is help people understand how to use the resources that are immediately available to them so that they end up having to devote less of their income toward specialty services, flying across the country to see someone, or some expensive service that may or may not be beneficial. I try to do a good job in the book of helping people make those kinds of decisions. So that process, part of it was that's how my situation started out. I was in a small town. I had to stop obstetrics. I started a new practice. That was a financial liability from the very beginning. And so income in the for that period of time during my recovery was somewhat limited, and I couldn't leave the practice. So I didn't have the option of going to see a Lyme doctor. I didn't have the option of flying across the country. I had to use things that I could bring to my doorstep, and I had to learn how to use my local physicians and the people that I had at my immediate disposal well. And I think that most people can do that, but the book does help define, well, okay, when is it that time that you might want to go see a Lyme doctor? When should you pull that service in? And when you see those people, what kind of questions should you be asking? What kind of services should you expect from your local doctor through the local system? What kind of things should you be looking for from a Lyme doc? So the book is helpful for those things.
Thanks, great. Could you expand a little bit about neurological symptoms of Lyme? Someone had a question about that, and I guess they're experiencing this, and they're tough to deal with. So could you talk a bit about that?
Right. I think one of the fundamental things in a holistic approach is that you're not treating symptoms, you're treating the illness. And when you treat the illness, the symptoms gradually get better. Neurological symptoms are the most frustrating, and they take the longest to go away. So they're really, really stubborn. I do have a chapter that's devoted just to that in the book, and it's and some other things that you can do. Again, it's individualizing your route, your path to wellness. There may be things that you need, the extra supplements that you want to take, or extra therapy that you might want to pursue that might get you there a little bit quicker. Or are there medications that you might want to use to reduce those symptoms so that you can move forward? All of that is thoroughly addressed in the book.
How about sexually transmitting Lyme disease? Is that possible?
Absolutely, it's possible. And if you look at Borrelia, it's a spirochete. And the other most well-known spirochete is syphilis, which absolutely is spread sexually. So the possibility of Lyme disease being spread sexually is certainly there. I've certainly talked to plenty of couples that one member of the family is very outgoing, the other is not. They both test positive for Lyme disease. So possible, yes. Now, is it as likely as syphilis? The answer to that is no. Syphilis, the spirochete has learned how to, part of microbes is they have to learn how to spread from one person to another. And certain microbes, syphilis, the spirochete, mycoplasma, chlamydia, certain species of those microbes have learned how to spread sexually. That's the vector that they use to transfer from one host to another. Borrelia specializes in ticks, and other microbes do that also. It hasn't really learned or specialized in sexual transmission. So when you look at it, first of all, it occurs in very, very low concentrations in the body, but the concentrations in sperm are particularly low. So some experts say, no, it's impossible. You couldn't spread it that way. I don't believe that. I think it can be spread sexually, but I don't think it's the primary route of spread. I think it's primarily a tick vector-borne illness.
And I assume because of those comments you're making that the same sort of applies to mothers giving it to their offspring. Is that the same sort of situation, would you say?
Correct. Yeah, I think it can cross in utero, but I don't think it's that common, fortunately. But it's certainly possible, and it's certainly possible that other microbes do too. Yep, possibly more than we realize.
How about Herxheimer reactions? That's one a lot of people written about, just wondering about, what are these Herxheimer reactions they've heard about? Reactions, are they worse with herbs or with drugs? How long do they usually last?
Yeah, highly variable. A Herxheimer reaction occurs to certain microbes and it doesn't occur to others. Borrelia is a microbe that when the microbes die, the parts of the microbe become irritating to the body. They become inflammatory complexes that circulate through the body and cause fatigue and basically make the person miserable. They typically occur after therapy is initiated. So if you start herbs or start an antibiotic and your symptoms are worsening, it's probably a Herxheimer reaction. Highly individual. Some people have it very intensely, so anything they try to use, herbs, antibiotics, anything else, they get Herxheimer reactions. Other people, it's very mild. It tends to be much less with herbs, though, because you're not killing the microbes as intensely as you are with antibiotics. You're not killing other microbes as much as you are with antibiotics because it's not just Borrelia that can cause these kinds of symptoms. And the herbs reduce those inflammatory complexes, so the herbs are addressing the symptoms that come with Herxheimer reactions at the same time, where antibiotics definitely do not. So, but it's still very individual, very different for each person.
Got it. We've got one here that I've just been bitten by a tick. Should I get antibiotic treatment immediately? What would you say to that?
Yeah, that's a tougher question to answer too. Right now, the official stance of the CDC is no, you don't do antibiotics unless you live in a Borrelia-prone area. But to consider, we are identifying new species of Borrelia every year, and there are probably a lot of Borrelia species out there that haven't been identified, along with a whole spectrum of other microbes, a huge number of microbes that can be carried by ticks. Personally, I would do antibiotics. The standard is doxycycline, which gets most tick-borne microbes 2 to 4 weeks. Depends on what you can tolerate. I started having intestinal symptoms after 2 weeks of any antibiotic and really couldn't go any further than that. That being said, though, that the microbe is clearing the system very quickly and is fairly resistant to antibiotics in general. So when you look at use of antibiotics, the most benefit that you're going to get is in that first 2 weeks as the microbe is traversing the bloodstream and disseminating out into tissues which is occurring over the first 2 weeks to several weeks, that's when the antibiotics have the best chance of killing the microbe. They're knocking down the numbers enough that the immune system can suppress it right from the beginning. But that being said, I've had plenty of people that I've seen in my office that got a tick bite, took 2 to 4 weeks of doxycycline, and then 6 months later started having symptoms of arthritis, fatigue, and gradually developed chronic Lyme disease. So there's fairly good evidence that it doesn't always work. And we really, because these stealth microbes are so hard to find and so hard to diagnose, nobody really knows how well that works at all.
In that case, would you recommend that people also do herbal options in conjunction with antibiotics?
Absolutely. The cases that I mentioned where people were treated and then they developed symptoms 6 months down the road, I put them on 6 months to a year of our standard regimen of herbs, and they all got better and did fine after that. So the earlier you can catch someone and get them on herbal therapy, the better. And personally, I mean, if I became bitten by a tick at this point in my life, I may take antibiotics, but I'd definitely load up on herbs, and I would probably continue it for at least a year. I still take herbs regularly, and it's helped so many other aspects of my health. I don't take the classic antimicrobial herbs as much anymore, unless I get a cold or a flu or something, because they work so well for that. But I take just maintenance herbs for enhancing immune functions, reducing inflammation in my body, and that's the remarkable thing here. Getting ready to turn 60, my joints were much better than before I had Lyme disease. I'm doing the things that I want to do in life and don't really have any aches and pains. So I'll keep
That's great to
taking
hear.
herbs for the rest of my life.
Great. Yeah, people will love to hear that. Speaking of building up your immune system, the fact that you don't really do the antimicrobial ones as much, but more just for supporting your immune system. We've got a question here. Someone's got Hashimoto's, and they're wondering about possible ties between autoimmune diseases and Lyme disease. What do you think about that?
I think those are well defined. Autoimmune diseases have multiple causes, just like chronic Lyme disease or anything else. It's all based in chronic immune dysfunction. But when you look at how these stealth microbes function, the link between that and autoimmune illness just has to be there. I think science is still defining it, but when you look at how these microbes function, they enter their body, they're very stealthy, they infect white blood cells, and when they do that so that they can manipulate the immune system. But one of the first things they do when they infect white blood cells and other cells in the body is they turn off the ability for that cell to destroy the microbes inside. And then they turn off the ability of the body to recognize that cell as being abnormal. So you have these cells in the body that are abnormal, they're defective, they have microbes inside, and the body isn't getting rid of them. But sooner or later, the redundant parts of the immune system catch up with that thing and make antibodies to it. But it's indiscriminate. It's not necessarily making antibodies just to that abnormal cell. It's making antibodies to other cells that look like that cell. So it shouldn't be a far stretch to think, well, maybe that's a possible mechanism. That's part of this autoimmune phenomenon that we see. And if you look, there are many studies that have come out over the past 5 years that have shown connections between different kinds of autoimmune illnesses and microbes. Multiple sclerosis with chlamydia and other stealth microbes. Parkinson's with Borrelia and other stealth microbes. ALS with Borrelia. Mycoplasma with rheumatoid arthritis. And conventional medicine says, well, they're there, the microbes are there, but we're not sure that's really the mechanism. It may not be a smoking gun, but it sure is pointing in that direction. So I think that's in the future an area that is going to be very important for science to explore this concept of this chronic immune dysfunction and these low-grade microbes in the body and these widespread non-specific symptoms that are common to all these illnesses. There has to be a link. There just has to be a link.
Another thing I want to ask you about, since you're in a unique position of being a medical doctor who's worked in conventional medicine for a long time, but also having your specialization in holistic options, we've got a lot of viewers out there who are really frustrated by the fact that they feel like their doctor in conventional medicine in general doesn't really take Lyme disease seriously. What do you think the reason behind that is, and what, if anything, can you say to kind of console these people or give them some hope?
They don't have time to take it seriously. That's a real problem. You know, when I was doing primary care, I was limiting myself to, I was spending time talking to patients, and I was working with each individual, and I was able to see maybe 12 or 15 patients a day. If you're going to pay the bills, you need to see 20 or 30 patients a day per provider, and that's going to leave you time to say, hello, what's your problem? Let's get your symptoms, let's order your labs, and here's your prescription. They don't have time for complex illnesses like Lyme disease and fibromyalgia. Once it gets progressed to the point that it is an autoimmune disease, then you get referred to a specialist, but your average doctor just doesn't have time for it. And again, that's one of the functions of the book, is to help people understand their own situation enough that when they walk in their primary care provider's office, they'll know what kinds of questions to ask. Then they'll know how to use those resources, that they're going to get a good response, and they're going to find it to be a useful experience, where so many times that doesn't happen. The patient walks in with a list of symptoms, and they're very frustrated, and they don't know what's going on, and they unload this on a doctor who's got 10 minutes to figure it out. They don't have time to figure it out. The system doesn't allow them to do that. And I think it's very important for patients to start understanding how to use that medical system better to get the most benefit. And when we start doing that, I think we make the medical system work better.
Dr. Rawls, it looks like you're doing pretty well these days, and like you're saying, your joints are better than they were 10 or 15 years ago even. One thing people want to know is the big question: is it possible to be cured from Lyme? Would you consider yourself cured, and is that a possibility? What does that mean to be cured, or what are we really shooting for here?
It depends on your definition of cured. I think for a lot of people is, have you completely eradicated the microbes from your body? And first of all, it's never one microbe. No, you never completely eradicate all the microbes. Whether I have Borrelia still in my system, I don't know. I would suspect that if I let my guard down again, I would start getting sick. But I'm fairly vigilant about staying on herbal therapy, doing the things that I need to do. And I know now, it's like this past summer when I was writing the book, you systematically look at your situation. If you're not feeling that robust health, you become much more attuned to your body, and you make corrections fairly quick so you can bounce back. And I've learned to do that over the years, and that's part of helping people live with Lyme disease. I think your goal is living a normal life. You want to be at an age where you're doing the things that other people at your age are doing, and you can live a normal life. And what I can say here, almost at age 60, is that I'm living a normal life. I'm doing the things that I want to do. I would actually say I have more capacity to do many things that people my age can't do. In many ways, I'm in much better health than the average 60-year-old. Whereas so many people are falling prey to poor diet and other things just sedentary lifestyle, I'm living a different life and enjoying it. And that's what I would like for every person that reads the book or follows any of our programs or anything else.
Awesome. We've got a more specific question here now, wondering about your opinion on the best treatment plan for Babesia, a common co-infection of Lyme disease.
Right. It's Babesia is the one outlier that is tick-borne that we know of. It's a protozoa. It's a distant cousin to malaria. It's a much less virulent microbe than malaria. In other words, it doesn't have the capacity to cause illness. And in fact, the vast majority of people that contract Borrelia, if they have a healthy immune system, will never develop any symptoms, Babesia, and will never develop symptoms of Babesia. Babesia is more virulent than Borrelia, though, and there are cases that people do get ill. Typically, the illness is associated with high fevers, chills, shakes, feeling miserable. People get acutely and deathly ill, and then it passes over several weeks, but the microbe can stay dormant in liver and spleen and then come out, reactivate. And typically, a chronic infection with Babesia isn't chronic continual misery, but reactivation of the microbe and a reactivation of acute symptoms that would last several weeks, and then it goes through the same cycle again, which is also typical of malaria. Malaria, most people don't stay chronically miserable all the time to a high degree, but they have relapses of the acute infection. So when you look at herbal therapy, many herbs, many in the protocol that we use, cover for protozoa. Some cover a little better than others, but it depends on the condition of the person's immune system and how miserable they are, really. Herbs, I think, are a good solution for most people. There are some physicians that would, of course, agree with that. I disagree with that. The problem with the drugs is they're all really toxic. Everything out there for Babesia has just some extreme toxicity. So unless someone has absolute defined symptoms of a severe Babesia infection and they have a positive test for Babesia, I would suggest building that restorative base, seeing how far that carries you. If you do have these recurrent symptoms of night sweats, chills, feeling horrible, relapses, and a positive test of Babesia, though, that's a point to probably sit down and talk to your doctor, decide if an antimicrobial therapy is indicated. But like everything, if you're building that restorative base and you end up having to use a heroic therapy that's very toxic, then the chances are that you're going to get well faster, going to have to use that therapy for a shorter duration of time, and possibly at a lower dose. So again, build that restorative base, treat symptoms as you need to, and then when it's appropriate, when you have that acute terrible thing, then look at the heroic therapies to come in and take care of that situation. But if you're just trying to do heroic therapies alone, the chances of getting well are much reduced. It's that holistic approach to therapy that's so remarkably important.
And I know you don't cover every single co-infection out there, but there are a lot of those in your book, right?
Absolutely, yes.
Great, awesome. I hope that answered whoever's question sent that. And then we've got one more specific question for you. Just could you talk about heart arrhythmia and some of the potential connections there with Lyme disease?
That one is very personal. I had some neurological symptoms, but it very much affected my heart. Before I knew I had Lyme disease, I was working on a diagnosis of fibromyalgia, and I started getting chest pain and irregular heartbeats. My heart was flipping beats every other to third beat. Exercise became impossible because I was so uncomfortable. That landed me in my primary care doctor's office, who quickly sent me to a cardiologist, and within the next day, I had had a cardiac cath, and all my vessels were completely clean. The cardiologist said, you know, you got these irregular heartbeats, don't really know what's causing it, but here's this beta blocker, and that might help you some. And that was about all that was offered. And none of them had any suspicion of a microbial infection, especially Lyme disease. But when you look at Lyme disease, Borrelia in particular, what that microbe wants is collagen. And so it's going to areas, it's generating inflammation in areas of the body where there's collagen, so it can use that resource. Where do you find collagen? Joints, eyes, brain, skin, and heart muscle, especially. So it's not uncommon for Borrelia to infect the heart. Bartonella is another one that infects blood vessels. So we see a number of microbes that can be involved with the heart situation. I couldn't take the beta blocker. It made me feel miserable. And that's about the time that I started embracing herbal therapy. I later found that I had Lyme disease, embraced herbal therapy even more intensely. It took about 2 years for the symptoms to go away completely, but they did. And it's just a matter of time. Again, I was treating the illness, not treating the symptom. At that point, I knew of no other resources, and I just was very aggressive with the herbal therapy, and it took care of my symptoms. Even so, severe neurological symptoms or severe heart symptoms are something that does need to be addressed, and sometimes that is an indication for antibiotic therapy, and sometimes, at least in the short term, aggressive antibiotic therapy. And I discuss that in the book pretty thoroughly also.
Thanks, Dr. Rawls. Last question here from our customers. Given your expertise in herbal options, could you just give everyone a brief summary of sort of what regimen you would recommend as a good all-around basic herbal regimen for Lyme?
Sure. I started with Stephen Booner's regimen, which in his original recommendations, as Stephen Booner is a master herbalist that has done a lot of work with Lyme disease, and started out with his protocol with Japanese knotweed, andrographis, sarsaparilla, cat's claw. I added a special preparation of garlic to my regimen. Most garlic is great stuff. It has great activity against protozoa, viruses, a wide range of microbes. The problem is garlic, when you eat it, and garlic when it's crushed, the chemical that's active is very volatile, and it's gone. It breaks down very quickly. But there are several companies around the world now that have stabilized that substance called allicin. So you get 100% yield in the products and in the extracts that you use. And I found that particular garlic extract is profoundly important. Because so many people have disruption in gut flora, I also add a little bit of berberine in my basic formula. So that's a core. That's the core of the antimicrobials. But you also need things to decrease the inflammatory mechanisms that are going on, what we call inflammatory cytokines. The mechanism of how these microbes are working is they infect white blood cells and cause a white blood cell to generate cytokines, chemical messengers that bring in more white blood cells and produce substances to kill microbes, but it also breaks down tissue. So if you generate an exaggerated local inflammatory response, like in a joint, it breaks down tissues, and the microbes can have access to the collagen and the things that they need. So reducing those inflammatory cytokines is important. Many of the mushroom species, cordyceps, reishi, are very good at reducing some of those inflammatory cytokines. And then covering the spectrum of microbes, I add in Chinese skullcap, which is another wonderful herb. I found that Rehmannia is very nice for reducing some of the autoimmune phenomenon that occurs in everyone. Glutathione really is very nice. When I was in really the thick of my symptoms, I started developing a fairly significant hand and head tremor and started taking a special extract of glutathione called Cetria. And within 2 weeks, all of those symptoms were gone completely. Glutathione is a potent antioxidant. It helps with detoxification, and it can chelate and help remove some heavy metals from the body. So those are some of the basics that I use. I round it out with some other herbs, and then turmeric and other things for anti-inflammatory purposes. So we in the formulas that I create, we put those things together into easier packages that people can just take several capsules of each formula a couple of times a day, and it covers the bases and makes the whole process of figuring out what to take a lot easier.
Great. And I know it's, herbal is not necessarily the end all be all, but it sounds like they can provide a really great foundation. So just wanted to give everyone a little overview of that since they're looking for some guidance.
Yeah, I think it's important just to end things to really state that I'm not opposed to ever using antibiotic therapy. I think there are indications. I think there are other heroic therapies out there that are important. I think every person's case as an individual is different. But building that foundation, building that core of support to restore the ability of the body to take care of itself, along with those other things, is extremely valuable. And I think that's what's missing in most treatment protocols across the country now.
Well, Dr. Rawls, thanks so much for answering all my questions, all of our emailed in questions. I hope it was helpful to all our viewers out there. What are your plans now after this book, Dr. Rawls? Do you have any more writing in order, or are you going to take a break for a while?
There are always things to write. There are always books out there, programs for helping people. We found a lot of benefit that through a company that we work with that you're part of, Tim. We create programs that help people through this whole process through emails, and we're going to continue refining those things, continue refining the products to make them better, easier to take, more user-friendly. I think that's where my life goes now, is just immersing myself in this. I'll say also that I last year before the book, I gave up my medical practice because I found that I just wasn't helping people well there. But I do consults now, and often I can take someone's situation and then in a 45-minute consult, pull together a lot of things that they're just not seeing and help them see how to better use their resources and put them on a positive direction. So I think many people have found that to be very useful. It's just all the years, everything that I've been through and all the people that I've helped gives me a special vision that I can see things that a lot of other doctors just can't see. But I'm not limited geographically with that. I can help anybody with a computer that I can get to. If we have a special person that we become close to, that I've helped her with her life in Scotland and others in England and all over the United States and Europe. So I see my future is better in helping people that way. It's more cost effective and it gets them where they need to be. It gives them that expert advice without having to travel across the country to get it.
So if anyone's interested in that, I know you can sign up for consults at rawlsmd.com. And we're so excited about getting this book out to folks. We think it's going to help a lot of people, just make sense of their situations. So we really hope you'll read it. And we'll say goodbye to you now, Dr. Rawls. Thanks again for joining us, and we'll have future webinars. So look forward to having those. Thanks again, Dr. Rawls. And I'll put this slide back up for the book for everyone to see that. So once again, everybody, to buy the book, visit us at unlockinglyme.com, and we've got the special end of this week. It's going to be $2.99 for the Kindle version rather than regular $9.99, and then the print copy is $10.49 instead of $16.95. So take advantage of that. Spread the word about this book. Definitely want to help as many people as we can and get our message out there. And then if you get the book this week, the special prize for being a registrant of this webinar, we're giving you free an Unlocking Lyme email series written by Dr. Rawls. I believe it's 15, I'm not 100%, but 15 emails that will kind of walk you through the steps of making sense of how to steer your recovery. And then we've got the free download of Suffered Long Enough, a PDF version of that. And then lastly, we've got the online interactive health survey and symptom tracker surveys to help you track your progress as you attempt to get in a better place with your health. Thanks so much for being here. I'll leave this slide up for a little bit, and we hope to see you on another future webinar with rawlsmd.com. Thanks.